Oh, well, we are back. For those of you that just joined Rinad and I in the previous session, apologies. Apparently, we were cut off as I was saying something exciting, and we're just getting used to similar to that Zoom function where they make you leave even though you're not ready to leave, which is probably a good thing because I can keep talking for a long time. So this is going to be a fabulous hour of a panel. I'm going to throw to Rinad, who's going to sort of just introduce it and start hosting it. And Rinad and I, as I said, will go between the two of us. Over to you, Rinad.
Awesome. Thanks, Robyn. So I'm really excited to introduce this panel. The title is Implementation Science and Behavioral Insights, Better Together Than Apart. I'm Dr. Rinad Beidas, for those of you who are just joining us. I'm the founding director of the Penn Implementation Science Center. I'm also an associate director of the Penn Center for Health Incentives and Behavioral Economics. And I'm really excited for this discussion as an implementation scientist who's come to behavioral economics over the past few years. And from my perspective, I think there's kind of two ways to look at this, maybe three. How can implementation science benefit from behavioral insights? How can behavioral insights benefit from implementation science? And then kind of the synergy. So I personally would argue, not to steal anyone's thunder, that the fields are stronger together than they are apart, but it'll be really interesting to hear what my esteemed colleagues think. I think that this integration has the potential to transform the seemingly intractable challenge of moving the needle in healthcare equitably. And so I'd like to briefly introduce our three illustrious panelists. What a group. You're in for a treat. So we have Dr. Robyn Mildon, the Executive Director of the Center for Evidence and Implementation, Dr. Gyani, the Head of Research at the Behavioral Insights team, and Dr. Joanne Yoong, the founder and CEO of Research for Impact. So I'm going to toss the baton back over to Robyn, and she'll take it from here.
Yep. So we will just do as Alex and Joanne, if it's okay, just briefly introduce yourselves when you come up. So again, I'm not going to say anything more about myself. But what I would like the panelists to do, just to connect it to the keynote that Rinad just presented, just if Alex and Joanne, you could just make a couple of comments or thoughts or maybe a question for Rinad that you had based on her keynote, and then I will pass back to Rinad to sort of take us into the next section. So, Joanne, I'll ask you to start first.
Sure. Hi. What a delight to be here, and thank you for that amazing keynote. For those of you who didn't join us for that session, you're probably now full of regret. But my name is Joanne Yoong. I'm at the University of Southern California, where I'm a senior research scientist and economist at the Center for Economic and Social Research. But I'm also founder and CEO of Research for Impact, which is a Singapore-based research organization. And what we try to do is make research accessible and transformative, focusing a lot on populations in Asia. And so I wanted to give, I think, my take on the keynote, which I thought was amazing. And again, not to give everything away, but my answer to the question of the panel is absolutely better together. My own personal journey, I think, is in reverse of Rinad's, which is I am a behavioral economist, or actually I'm a development economist who came to behavioral economics and now, hopefully not too late in life, has come to implementation science. And so absolutely coming from the other direction, I've come to the same conclusion. I think my reflections on the keynote, I think I had sort of three things to say. And firstly, I thought it was an amazing reflection on three of the great themes, I think, that are going to dominate the healthcare landscape in the next 10 years. And one is healthcare equity, and the second are the social determinants of health, and the third really is mental health. And what I thought was amazing about this was that, you know, what the keynote really emphasized for me is that bringing these three things together and discussing them simultaneously against this backdrop of resource scarcity is really critical. So we have these background themes, and what we really need to understand is that we've spoken a lot in healthcare about a systems approach in the past, but really we haven't thought about systems in an integrated way. And we've thought about taking a systems approach from a very macro level, but what we really need to think about is integrated care, community care, and change management against this backdrop of value-driven care and resource constraint, right? Taking into effect all of these human factors at the same time. Now, that's a very difficult and challenging balancing act to do, but not admitting it and not making that seen in a very critical way and being very explicit about it is going to harm rather than help our progress forward. And I think that takes me to the second thing which I wanted to say, was that I thought that that comment that was made, that policy factors, institutional factors, and individual factors all are part of that continuum. And what we've seen here in Singapore, for example, we do many things very, very well, but some things we're still struggling with. And part of that is that we're a community that has historically in the past been very focused on adapting international best practice and trying to replicate and scale things rather than from an internal point of view, try to understand these factors from the ground up, and really take into account the fact that when we see something as a failure to launch, we often frame it very negatively rather than a learning experience, and trying to say that implementation failures in some sense are really about having a learning healthcare system. And so what I thought was really fascinating about Rinad's talk was also the description of what an iterative process, just including implementation science within a healthcare system is, and that journey of the healthcare system itself to try to bring implementation science into its DNA. The last thing I thought that I really took away from this talk is how this is really a team sport. And we're talking about it on so many levels. And then we're talking about the healthcare workforce as a team, but also bringing in these participatory designs and trying to think about bringing everybody's input in from various levels of expertise, understanding our own limitations, but how well we work together, both from a research point of view as well as an execution point of view, and how that's really critical because none of us, again, I mean, more broader level can do things apart. We are really better together. All right, back to you, Robyn.
As per usual, Joanne. And I will also give a plug. Joanne is working with me on to set up a new centre at the National University of Singapore called the Behavioural and Implementation Science Interventions Centre. So Joanne and I get to do all sorts of this fun stuff together over in Singapore. And Joanne, I should have said before, very, very kindly, and I owe her a huge favour, joined this panel at the last minute when we had a change of person, and look just what a pro she is. Alex, over to you.
Thanks, Robyn. And thanks, Rinad, for a really fantastic keynote. I'm dialing in from Gadigal land, actually, in Attic in Sydney. And I'd also like to pay my respects to elders, past, present, and future from here. As Robyn and Rinad mentioned, I'm the Director of Research and Methodology at the Behavioural Insights team in Sydney. So basically, it means that I end up getting involved in lots of interesting pieces of research across different areas of policymaking. My personal story in sort of getting interested in this space, I think actually the sort of very personal part right at the beginning was I probably would identify quite closely with the Emma that Rinad and sort of mentioned at the beginning in terms of going through some probably difficult times and then receiving some pretty dodgy treatments and then actually almost becoming an evangelist once you receive these evidence-based treatments yourself. You're like, well, actually, this works. Why aren't people getting it? Which then led me into an academic career, looking at how we get evidence-based mental health treatments into the system, and kind of going in there as a pretty blasé sort of 20-something with a lot of bravado, saying, you should just be doing this stuff here. Like, why aren't you using these treatments that show that have been shown to work? And then actually very quickly realizing there are some real concerns actually that Rinad went through in quite a lot of detail around why people aren't using these treatments. And without listening to that and kind of understanding the system, we can't make it better, and we can't make it better for patients. So I really actually liked the way that Rinad, you sort of opened your talk by talking about the no-do gap. So I think we hear a lot about the science practice gap. And I think quite often when you read about it, there's a sort of, it's never as explicit as I feel like some of the authors want to be, but it's like, we've got this idea from the scientific sort of standpoint, and then there's the practitioners who aren't doing what we want them to do. Like, we should be moving the gap. And it's basically, why don't we get the science of the practitioners rather than this sort of true meeting in the middle? So I think that is a really important point. And I think one that kind of came through, and I may be projecting here, but came through quite a lot in the talk. And I think specifically the point at the end around, like, how do we make it easy? How do we make the systems easy for all of the actors in the system to essentially deliver better care? And I think that is an area where BI, I think, has done quite a lot of work. And And I think something that, from the outside of the implementation science sort of world and community can learn something from. I absolutely believe that they are better together. I'm also happy to throw in a few sort of pointed discussion points to make sure that it's not a panel where we all just continually agree, because I do think we learn through sort of constructive discussion. But yeah, I think that point around making it easy is something that the sort of implementation science community can learn from. But I also think there's a particular sort of iterative mindset that also comes out of the implementation science practice around measurement that I think actually the BI community can learn from as well. I think sometimes maybe it's a bit too iterative in that I was just going through this wonderful book here.
Can anybody shut his camera off? Is there some way to shut his camera off? Like, are we able to do that? Just like, go on, Alex.
This wonderful book, as I was mentioning. But I think one thing that struck me was that there's quite a lot of surveys and measures that kind of get used once and then kind of get put aside. And I think it's really interesting to see actually, the frameworks that we've used in the BI space, then they're certainly not perfect, but I think we've kind of doggedly stuck to some of those key mantras, for better or for worse, which has led to a different sort of set of outcomes. But anyway, I've talked long enough here. So happy to hand the mic back.
It's a brave man to hold a book up of a co-author on a panel and then say, yeah, but that's exactly why we have you here, Alex, just to spice this up. I'll make a couple of quick comments, Rinad, and then you might want to respond or take us to wherever you'd like to go from here. But I started my training way back as in psychology. Now I don't practice psychology anymore, and in fact I started as being trained as a behavioural in the behavioural science area of psychology. So those of you that studied that, Skinner and the box that he used. And came to implementation science out of a series of what I would call quite large career failures, where we secured very large grants here in Australia to bring evidence-based programs to families, particularly families who had been identified as the system for child neglect and often had their own mental health and/or cognitive issues from the parents' side. And luckily or unluckily, the group of us that were running this initiative at the time, which was funded by a federal grant by the Australian government, tracked the extent to which material from a website we developed was used. Training was, anything post-training was implemented when they went back to do their jobs, and it was a variety of social workers, speech therapists, psychologists, so multidisciplinary. And the actual implementation of what we were sharing, that is these evidence-based programs and approaches that could help these kids stay at home, or at least enable them to return home from out-of-home care, and/or make sure that home was safe and a very nice place for them to be. These initiatives were very rarely implemented, sometimes at the rate of 10% post-training that people would implement anything in terms of the program that we'd developed. So it's almost, if you think in a healthcare setting, that's a scandal. So what if with the vaccine, if we watch now, everybody's tracking the percentage at which and the speed at which the vaccine's being rolled out or implemented. If that was up to 10% right now, oh my goodness. Often, though, our experience is where people are in trouble or their well-being is compromised or they are of low income, they don't always get the best of what they deserve. And so I came to implementation science and research translation and understanding what evidence is and isn't through thinking something has got to give. I can't spend the rest of my career trying to train the workforce to implement more evidence-based programs and just, as a good colleague of ours in the US, Rinad Al-Samet, says, spray and pray and just cross my fingers and hope that those interventions get to those who need it. So to me, even the question of this panel, which was we all came to collaboratively, is a little bit provocative because I've never thought the two things are different anyway. They're just different ways around supporting behaviour change, then thinking about how to work with organisations to embed that behaviour change, and then thinking about how to work with the policy setting to sort of facilitate and support organisational behaviour change, and sustaining. I mean, we talk a lot in Australia and Singapore, in fact, and in the UK, scaling and sustaining. No one really quite understands how to do that well yet. Often initiatives aren't tracked over time enough to understand. So I think we have a lot to do, and some implementation scientists just already talk about behavioural interventions as if it's part of implementation science. So I think through this we can, like Joanne, your comment around this is a team sport. It certainly is a team sport. We're missing other members of the team here, policymakers, practitioners, all that sort of stuff. But Rinad, would you like to make a couple of comments and then we'll move into the next section?
Just to thank you all for your insights. Your reflections of what you heard has caused me to think about our work even in different ways. And I think that is the power of this team sport and in coming together. And I think what I heard from all three of you was this deeply shared mission of wanting to have impact. Like, that is why we come to implementation science and behavioral insights and behavioral science. Like, it's all about capital I impact, right? And so I'd like to just jump into some of the meat of this because we don't have a ton of time together. And we were really purposeful in the group of folks that we put together here because each of us is on kind of a different continuum of, if there's two lines of behavioral science or insights and implementation science. I'd love to hear from you all on what some of the big wins and capital I impact you've observed in your fields. And I will say, just as like a small teaser on my own, and I'm happy to answer this after you all go as well, one of the reasons I've been drawn to behavioral science and insights is because my perception is that sometimes in implementation science, we've moved a little slower than I would like with regard to getting able to answer that impact question, whereas it doesn't seem to always be the case for behavioral insights. It seems like they've been able to demonstrate ROI, return on investment and impact. So I'm going to ask each of you to share kind of what some of the big wins are from your areas of expertise. And then we'll jump off from there. So Robyn, do you want to go first?
I thought we'd go the other way and go Alex and then loop back round. We'll do the alternative circle.
Whatever Robyn said is what we're going to do. So
that's
Alex?
Exactly it. Alex, did you hear that?
Cool. I did hear that, and I'll behave from now on in. Thanks, Rod. I think there's two abstract ones that I think I'm going to start off on, then maybe a concrete win, which I think kind of demonstrates both of those points. So I think the first sort of big win in the BI sort of space was really developing a shared language of behavior change within government and also within the public debate. I think we've kind of, as a psychologist, coming into government, one of the things that I found really interesting was that there's a lot of economists there, and the economists have this really strong sort of unitary language and unitary identity that I'm sure Gyani would agree. I mean, you speak to an economist and they'll say, I'm an economist, first of all. That's sort of their first layer of social identity. Whereas you speak to a psychologist, you'll probably go through sort of at least a meso sort of field of psychology before you kind of get to that I'm a psychologist point. So I think the BI community is really trying to kind of develop this shared language of behavior change, and that manifests itself in a few ways. So previously, I don't think governments were explicit about the fact that they were in the behavior change business. So this meant that problems that were behavioral in nature were discussed in terms that sort of isolated their focus. So if you look at things like court non-attendance, hospital FTAs, non-compliance among job seekers, those policy areas will view them quite differently, but through the behavioral sort of formulation, it's somebody not showing up. And by having this sort of prototypical formulation, you can then see what solutions jump out of that. Similarly, things where sort of problems where you've got a small group of people who are doing something, who are very different to the majority. So you see this quite a lot in sort of drugs, alcohol, tax, fare evasion, prescriptions. The language of BI has allowed us to see, well, that's a social norms problem. So we've got a set of interventions that we can use there. And I think one of the ways in which we've done that is to really distill some of the behavior change language from the sort of big taxonomies that previously existed to very simple sort of like frameworks that are certainly not MECE, they're definitely not comprehensive, there's loads of things missing, but even the ordering of our EIS framework, which stands for Make It Easy, Attractive, Social and Timely, the main thing that we want you to get from that is make it easy. And actually, if you stop reading at that point, you've probably got enough of it to spread going to get it spread through the system. The second sort of abstract point is encouraging a more experimental approach within government itself. So we've really focused on running trials in the field, randomized control trials where possible. And I think when you do undergrad psych, you're always taught, there's this trade-off between internal and external validity. Like actually, if you can test in the field, then you can learn, you can get both to a certain degree. And I think this has had some further effects. So some of the early work that we did on testing, the addition of 9 out of 10 people pay their tax on time to a letter. Basically, when that work was presented back to the government heads, and it was a successful trial, brought forward hundreds of millions of pounds and made real savings of tens of millions of pounds. They spent quite a long time discussing it, and they loved the fact that they could see the implications of a policy out there in the wild. This made them see the value of experimentation. It made them understand the fact that some of these academic ideas can have an impact in the wild. And importantly, it had a direct impact on their own KPIs because we were really using some of that admin data. So I think that really had quite a big impact. So in terms of concrete terms, there's a nice example of some work that we did in Victoria, actually, where you're dialing in from, Robyn, where we were looking at the impact of a sugar-sweetened beverage tax, which is a policy that gets raised quite often. We now have one in the UK, but some of the genesis of that tax actually started in Victoria, where David Halpin, our CEO, was Vic Health, who are basically the public health body in Victoria. He was their leading thinker. And as part of that, we ran a bunch of RCTs. One of them was one in which we added a 20% price differential to unhealthy drinks in the hospital. And one of the key things that we focused on there was not just, does it work? We kind of thought it probably would work, but how does it affect retailers and is it publicly acceptable? So by running that trial in there, we were able to garner evidence on those 2 points. And I think the stuff that you're talking about around participatory design really sort of is emblematic of this, the importance of this. And then basically we're able to take that evidence and use it in the UK to say, actually, you know what? This would make a difference on health outcomes. It'll be far less controversial than you might expect. And actually the retailers won't necessarily have the same sort of impact on their bottom line as you might expect either. So by running those experiments in the field, using this sort of behavior change language, so we focus on substitution effects rather than the very sort of jargonistic language of cross-price elasticities, we were able to kind of get people behind this tax. And I think that has actually been a big win in the BI space.
Thanks, Alex. Joanne, do you want to go next? I think that's what Robyn said, and I'm following instruction.
We're just going to follow. It's always a good rule to follow what Robyn says. Alex, I think those were great observations. I would say, though, that that economists are not have you been to an economics conference? It is like Gladiator, right? But I will say it's true. Economists only fight with each other insofar as there are no other economists around, and then we sort of gather together and sort of suddenly become the best of friends, the enemy of my enemy, and that kind of thing. So I think that actually, so I wanted to also say, let's follow this this great trend of 2 abstract and 1 concrete sort of contributions. And I think what we've seen with behavioral insights or behavioral economics is 2 things. One, I actually absolutely appreciate the fact that what behavioral insights has brought to us are frameworks that are actually applicable. And I think what economics theory has done for many years is create sort of totalizing narrative. And in the case of the Chicago School, sort of this cultural imperialism where economists think that we can analyze almost any problem with this sort of a neoclassical sort of rational framework. And I think what behavioral insights has done is really bring to us, again, with things like the EIS framework. And I appreciate Alex sort of saying that it's not a complete framework, but it's one that works. It's one that works and is cognitively and from a feasibility point of view, tractable and effective. Much more effective, I think, than going through some of these very complicated structural econometric models that we have that literally take 30 years to run. Right? So it's been a very practical applied science that's brought the concepts of decision science, I think, into the hands of policymakers, and that's terrific. I think the other thing that's been really promising is that we've seen the growth of behavioral insights or behavioral economics units around the world. And so we used to have this modality, and I think even sort of 20 years back, where what we would do is chop our experts out, and they would pontificate or consult on what has been done, and then sort of give their insights and then leave. And then again, the implementation on the ground is left completely without without any traction. But what we've seen, and I think part of that again is thanks to BIT, is not just sort of spreading the gospel as we know it, acknowledging that that gospel changes, but also building that capacity at the ground level around the world. And now we have, 200, 300 behavioral science units advising governments around the world. And I think that's really terrific. And also it's taught economists that, very important fact, which is that you can't think your way out of some problems. Having this very empirical ground up approach to the solutions on the ground is it's not just nice to have, but really critical to have. So just coming back to what I think are the critical big wins in the field, I think 20 years ago, and actually with great contribution actually from the University of Pennsylvania, we saw in the finance space, behavioral economics really revolutionized the pensions landscape in terms of long-term security by changing defaults, by changing the way that people invested, making it much more easy for people to participate. We really altered the entire the entire sort of long-term financial security landscape. So we used to have defined benefit plans in most countries in the world. Once we changed to defined contribution plans and people had to make decisions about their own long-term security, participation was a huge issue, figuring out what to do was a huge issue. And I think behavioral economics at the time, with all the evolving thought about what it would take to make the pensions landscape tractable, actually stepped up and said, let's make it easy, let's make it automatic, let's change people into opt-out defaults. And that's really made a huge difference. And I think in the last 10 years, what we've seen are, people also realizing that investment strategies that are self-driven, sort of target date funds or robo-advisors, making investing itself easy, has made a huge difference. And what I see in the healthcare landscape, from my point of view, again, this is a bias of my own field, is that we're seeing these insights now move over to universal health coverage, where we're asking the same questions about what it takes to get people into insurance schemes. What does it take to get public policy schemes to streamline themselves? So on a policy level, what we're seeing are insurance programs and schemes that are now set up to opt people out, which I think is really critical. We're seeing the same conversations about things like long-term care and end-of-life care. We're seeing governments now understand that, for example, very small user fees are likely to deter participation, particularly in low-resource countries. And we're seeing a lot of discussion about what it takes to deal with the resource scarcity, because one of the great insights, I think, from behavioral economics is that no one works well under resource scarcity. And that mitigating that, whether it's individuals, whether it's healthcare providers, is really critical. So we need to address not just making it easy, really the system factors that prevent us from moving forward. Okay, back to you, Robyn.
All right, terrific. I'm sorry if you see me fiddling with things. I'm hooked up to a bunch of microphones here, and you went really quiet then, Joanne. So I'm trying to fiddle with my clothes to. I don't get to leave this room for 2 days, so anything could happen by the end of the day tomorrow. Rinad, we have a couple of questions coming in that are quite cool. I'm going to answer that question quickly. I think it would be good also for you to answer that question. And then, but people keep some questions coming in. I'm going to facilitate the questions because I'm all set up to do it here. But just quickly, I think one of the contributions that implementation science has made, I'm going to do a little bit of take Joanne's lead and do processing, then some content is. The thing about implementation science is it's distinguished by its aim to learn about implementation. That is what it's about, right? So, and that is, it's not that it's limited to judging whether something is worth doing again or whether something it works, because of course that's part of the science of studying implementation. But implementation science has led to people understanding we need to take that a bit further, and that actually understanding whether something is being implemented, sustained, whether it needs improvement, whether it's okay as it is a whole other area of study itself. And that implementation doesn't stop and start with a Gantt chart, because often people will say to me, I do implementation too, and then they'll show me a Gantt chart of a project plan. And I'm like, that's super. That's important, but insufficient to get the effect. Or they'll conceive implementation to begin and end at training, or to begin and end at the dissemination of clinical guidelines in and of themselves without extra strategy. So I think that contribution in the last 20 years since the science implementation has accelerated has made quite a big difference. And I see that's where the behavioural and implementation science area can come together. I remember Alex talking to David Halpern about this, and he himself, and he might watch this and say and disagree with me now or deny ever saying it, so let's see. But, you know, he was quite taken with the idea that what does the behavioural insights movement do post-trial? You know, so the incredible amount of trials that area of work has developed, but then what? You know, so are the strategies being sustained in other settings? Do they generalise across context and country? You know, I really love one of the other things, the second thing that implementation science has really kind of, I think, improved the world on is context really matters. It really, really, really does matter. And for a long time, I think we thought it was, you know, especially in high-income settings, less so in low-resource settings, and there's some work I'm going to talk to about that, is that we could just pop these kind of same strategies once they were shown to work in one place, that we could just take them to another place and they would equally work, or another culture or another group. And here in Australia, I think about Aboriginal and Torres Strait Islanders and how we have not helped at all in trying to apply, you know, take things from another setting and just apply it into their communities, their culture, their people. The second is I think a lot about Singapore, Joanne. Working there for long enough now, it isn't, you know, context really does matter. And it isn't like for like, and we can't, you know, so I'll say that's the second big contribution. From a content point of view, there is this amazing paper that did the job for me, so I'm not going to do it for them, but Kilbourne, Glasgow and Chambers, colleagues and friends of Rinad and myself in the US have just published this terrific paper, What Can Implementation Science Do for You? Key Success Stories from the Field. And I would just encourage everybody, it's open source, as all good things in implementation science are, and I would encourage people to go and grab that. It is in the main US-based examples, I will say that, and again, my point on context really matters. But there's been some real contributions around patient education and chronic disease management, primary care and mental health integration of depression treatment, so actually trying to get evidence-based depression treatments implemented into business as usual primary mental health care. Another thing implementation science really tries to do is how do we build things into systems, even if we must change that system to a certain extent. There's been some terrific work from implementation scientists around the dissemination of HIV prevention and treatment. There's a paper that his name now, Rinad, I'm going to embarrass myself. Anthony, Fauci, recently published his third
Dr.
author
Fauci?
around the use of implementation science in HIV treatment, patient safety checklists, and so on, diabetes. So these content areas, I think, have the potential. You'll note most of them are in health or mental health. Implementation science has a long way to go to kind of cross those areas over. And finally, there's a technical term that's used that I'm going to try and explain that I think really has been a major contribution, particularly in low resource settings, and that is this idea of task shifting. So what implementation science has been able to show in multiple studies across health and mental health is if we shift the work up and down either so there's good examples in HIV prevention where generally a doctor or clinician would have issued the preventative treatment. There's some studies in low resource settings going, we can equally train just as well non-trained medical doctors to do that. I'm going to reference Shannon Dorsey's work where she took cognitive behaviour therapy, she broke it down in doable chunks, and she showed us through multiple studies that paraprofessionals in education settings in Kenya of very low resource could actually implement them well with a little bit of extra implementation support post-training. So where we don't have more money and where we don't have more people, implementation science has been able to show that we can shift the task across disciplines, which will make things in the end more implementable and scalable particularly in the current circumstance. And if you think the call for equity and improving equity from implementation scientists is real at the moment, and being able to focus on those low resource settings and making sure they get what we get is really important. Rinad?
Yeah, I'm going to be brief because it sounds like we have some cool questions coming in, but I do have a couple of comments. So one is that I'm not the most patient person. If you knew me well, you would know that to be true. If you ask my kids, they would tell you that is true. And while I'm so proud of what we have accomplished in implementation science over the past 15 to 20 years, and I've been doing it for about 15, I also feel like it's not fast enough. And I've had a lot of conversations with my close colleagues about this, and some people feel like I might be being a little unfair because it's a newer field, but I want to be able to answer the questions of what impact has IMPSI had with like concrete dollars saved, lives saved. Like that's where I want to be. And I think we've done a great job at coming up with frameworks and outcomes and taxonomies of strategies. Abstractly, like I think as a field, we've coalesced as a science. I've seen a lot of work in kind of regressions, throwing in a bunch of factors and seeing what's related to implementation success. And that's moved us beyond some of the initial work when we were just trying to figure out, hey, why didn't these implementation things work? So I think we've learned a lot, and context matters, and that's a huge contribution. But really what led me to behavioral science and behavioral insights is that I'm at Penn, and there's this amazing group, Chive, that I mentioned, that has been applying behavioral insights to healthcare delivery. And I remember hearing the story about my colleague, Mitesh Patel, who directs the Nudge unit, which is the first behavioral science unit in a healthcare system in the world. And there was this small tweak made to the default in the electronic medical record to change medication from being name brand to generic. And with that small coding change in the electronic medical system, prescribing patterns went from 75% generic to 98% overnight. And there's a Freakonomics episode on how we saved $32 million in 1 hour. That is why I'm drawn to behavioral science and behavioral insights, behavioral economics. I feel like it has the potential to create scalable, low-cost change. But one of the things that I've learned as I've started sitting at the behavioral economics table is that it sounds like that last mile problem is there too. And I didn't realize that. So I've spent all my time thinking about how can implementation science be supercharged by behavioral economics? How can we infuse it into our frameworks, into our taxonomies? But now I'm seeing, there was this recent paper by Bird and colleagues on nudging at scale for financial aid forms. You don't see an effect. There's a working paper from Linos and Ember on nudge units and how the effect sizes are much smaller, than in the trials. And Alex is sitting up and he's ready to talk now. But now I'm like, oh my God, it could go both ways. And so I feel like mind blown this year. I'm like, it's bidirectional. It could be synergistic. So I think it's really exciting to have us all together here to kind of unpack the bidirectional learnings that we could have, because I think it goes both ways.
I'm going to give Alex, I think, Rinad, we need to give Alex a little, and Joanne a little, you each get 30 seconds to respond to that, because we do want to get to questions. You can see the countdown, but either of you want to respond quickly to what Rinad said?
I'm happy to jump in. So I think your conversation with David, I think he would absolutely still stand by that in terms of actually, if we run a trial, then what happens afterwards? Where do we kind of go with that information? And I think that's an area that we've been doing a bit of thinking on, but I do think it's an area where we can really learn from the implementation science literature. I think on the sort of the trials that are coming out, I get the sense that both disciplines are very much sort of drawn through a frustration, or sort of were born out of a frustration with that last mile problem. So I do think the different strategies that we have learned are complementary, and we can definitely learn quite a lot from that. There is a slight, I think another interesting question alongside that is what other disciplines can we learn from? So I think the system thinking literature actually does a really good job in terms of focusing on leverage points, which I think intuitively implementation science and BI do very well, but I don't think we've got the same language as the sort of systems thinking literature. But that's just a slight observation from the discussion we're having now.
Joanne?
I also feel so seen, Rinad, because I also teach this course in cost effectiveness analysis, and no one comes to it ever. But I do think that it's a crucial part of understanding the broader system implications, right? We start off with better design, choice architecture, implementing, and then at the end of it, we want to ask, is it worth it, right? We want to ask, can something work? Will it work? How did it work? Was it actually worth our time, but also our energy, our resource, our opportunity cost to make it work? And I think, right, exactly what you're saying is that we are seeing that it is bidirectional. I think we're seeing some really large trials now of SMS text messaging in financial systems where they follow people up, millions of people over multiple years, and they find that, yeah, we can get people into a bank account. But if after that they don't do anything with it and that account accumulates fees, perhaps we've harmed them rather than hurt them. And so thinking about sustainability, thinking about ethics, thinking about proprietary, thinking about how the system absorbs these nudges and makes them work is actually really critical. And the other piece which I also wanted to bring up was, I think part of the work that's done at Chibe is really amazing. We talk a lot about automatic hovering, but some of what we've seen in some systems is that you can introduce the technology for automatic hovering, but if the incentives are not aligned, if politically it's not possible, introducing just the technological means to put this in place without a broader understanding of the system means that it works for a little while, but it creates more resentment, some of these effects that we didn't fully understand. And so really they do need, I think, to work together. And some of the great examples that we've seen now, for me, I think, are really where filling in those blanks is really critical. Back to you, Robyn.
Okay, Rinad, I'm going to take some facilitate. You and I are like we should do this all the time, Rinad. We should go on a road trip doing this. So I'm going to take this question. The question's actually come to me, but I'm going to throw it to Rinad. So where it says Robyn, I mean Rinad. Question for Robyn, Rinad, and then brackets, possibly with an Alex response. We'll see how that goes, Alex. Should behavioural scientists try to do, capital D, capital O, more implementation themselves, e.g. plan and conduct implementation activities, or partner with implementation science experts? What are the trade-offs with each approach? Rinad, please take that.
I'm all
and
for
also,
team
can we
science.
speed answer? We're going to speed answer
Yeah.
now, Rinad, because we've got questions
Okay.
coming in left, right, and center.
Whatever Robyn says. I'm all for team
That's
science. I have learned so much just in this conversation. I think we should partner. I think it's hard for somebody who has a certain training and leaning to completely assimilate to another. I've been trying to do it, and I think it is better to partner. Okay, over to Alex.
Alex, speed answer.
Definitely better to partner. I mean, I feel like there's definitely a lot that we can learn from each other. I think also telling a good story of that implementation successes and failures, I think is also really important. I feel like in the BI world, and I'd be keen to get your thoughts, Joanne, as well, is that quite often we will do this implementation. There'll be lots of hard work and sort of blood, sweat and tears. And then we end up with a bar chart and we talk about how things work really, really well. And we don't do a very good job in the BI world of talking about our implementation struggles.
Joanne, you want to respond to that quickly? Speed answer.
Yeah, well, I think, right, Alex, we have seen some very impressive bar charts, let's first say that. But I do think that the best instances are where, in fact, there are these discussions, but they're not, they're discussions where context is part of the experiment and not necessarily sort of a discussion piece at the end.
Yeah, I would agree strongly to your question, Alexander, that partner, because there is a lot of training that comes with becoming a behavioural scientist and becoming an implementation scientist. Takes time. It takes quite a bit of experience, particularly in implementation science. There's not a lot of places to get training outside of the US and the UK. Joanne and I, again, are working on something in Singapore together that might help with that. And hopefully we'll do some things at Monash University this year. But it's very, so a lot of us needed to train on the job. And that takes quite a bit of experience of failures and wins and reading literature. And we, in a book that was co-edited that Alex was holding up before, there's a graph that we did just showing the absolute explosion of publications and new journals in implementation science. So I would strongly agree. And again, it goes back to it takes teams to do this work. I'm going to throw to another question here. Greetings from Wollongong, Australia. You might need to Google that, Rinad. How might the proposed implementation science, behavioural science complementarity assist with so-called de-implementation, a gap that we could potentially call the do-know gap? E.g., clinicians doing stuff that we know should be stopped, Or does behavioural science lens help suggest the implementation and de-implementation distinction is a FURPHY? That is an Australian technical term, the person wanted me to point out. Because change is change is change is change, whether going or stopping. Belinda. That's the person that wrote the question who I know. That's a terrific question. Rinad, you want to take that first?
Yeah, I'm going speed. First of all, I do know where Wollongong is because I studied abroad in Australia. So I got you.
God, you got me.
And I think that is such a brilliant question and I love it. And I'd like to spend a little more time thinking deeply about it and getting back to you. That being said, I think we could take the opposite of East. Is there an opposite of East, Alex? Hard, unattractive. I'll work on that. But I think that, we want to make the behavior that we're trying to de-implement the opposite of easy, attractive, social, and timely, perhaps. I think the implementation is, I'm kind of joking, maybe a little, but I'll ask my behavioral colleagues to weigh in on this. But there has been some interesting thought pieces. Wynne Norton has led a number of them on conceptually how de-implementation is different from implementation. And I think the behavioral strategies might also be different. But I'm going to ask Joanne to weigh in next.
Yeah, no, I think that's a great. I can actually say Wollongong. Did I say it? God, I don't even know.
You did say it. Well done.
Yeah, well, I think one of the insights of behavioral insights is absolutely coming is not the same as going, and that status quo bias and inertia is radically different to the brain than implementing something completely new. So when we want people to step back from accepted practices, there's a lot of differential framing that needs to be done and a lot of different strategies. So absolutely, this is one area where behavioral science, I think, has a lot to tell implementation scientists. Back to you.
Alex, you want to take it quick?
Yeah, I think that's a really great question. I think there is great evidence on the fact that people are largely, a lot of human behavior is driven by inertia in terms of and habit and what they've done previously. I think the way in which sort of the key win, I think, where BI has done this required the sort of global financial crisis for people to say, oh, actually, we should be using different tools and maybe not be using some of the instruments and theories that we previously had considered may not be as effective as we thought they would be. But I don't think we've actually got a good systematic way of thinking about the implementation. So I would actually, I think it's an interesting question and not one that I've got good answer for.
I mean, I think there are some examples of needing to de-implement because of doing harm. So we probably do have things we could study in terms of, where it's been, particularly healthcare is probably a good example. Our experience in early childhood, child welfare, families, it's very difficult to roll something back because the evidence, and in mental health, Rinad, sometimes isn't as clear cut. So it's very hard to say, look, that just shows it's going to do more harm with high quality evidence, and therefore we should stop. And I know certainly at our work at Centre for Evidence Implementation, we spend a lot of time trying to help possibly people understand why certain things should be stopped and other things should be put into place when we're helping design programs or select programs or put implementation strategies into place. So I think that's an excellent question. And I think the evidence community, the evidence synthesis community has quite a bit that they need to contribute here, because when we're going to go to the effort of trying to implement something, boy, we want to know that's going to make a difference, right? We really want to also make sure it's not going to do more harm. And so it's kind of, that's where, again, the evidence and implementation area really kind of comes together quite nicely. Rinad, do you want to add something?
Yeah, I just remember that Christian Helfrich has a framework that includes automaticity and de-implementation that might be a good place to look also to answer this question.
Okay, I'm going to change gears. We have a question from Haley here. I have a question for the panelists about how to build buy-in from government decision makers to allow for time and space to apply the context matters principle when they are driven by political budget cycles, impatient for quick wins, etc. Alex, I'm going to go with you first. We're going to do quick answers.
I think in terms of buy-in, I think the key question is, actually, what are the questions that those policymakers are thinking about, and how can you align the answers that you are bringing and the tools and solutions that you're bringing to the table with those questions that they are actually asking themselves? So that, I think, does create a more conducive atmosphere for doing sort of BI work, and I presume implementation science work as well.
Joanne, I'm going around.
Yeah, I think to that question, I'd also add the funds to make it work, because that investment's not just an investment in time and space. And I think every policymaker is different. I think, Robyn, my experience in the United States and Singapore, picking up on what Alex said, it's what that specific policymaker, what that cultural policymaking is looking at. And I think the last piece is that we have to do a good job, because we know that not doing research is bad, but doing bad research that doesn't actually lead to outcomes is actually also wasted money. And that's a really good way to lose not just faith in you, but in research as an enterprise driving this.
Rinad?
I think that established partnerships with systems, while you need to have individual partnerships with policymakers, allow for the longevity that you need to be able to partner over time as leaders change, visions change. And I think as partners, we have to kind of pivot. I do agree that our timelines don't always align. And I also think that we take too long in implementation science. So if you were to reflect on what I presented, that's 10 years of work, and we still haven't tested an implementation strategy. So, there's a lot that we've learned, but that's too long. And there's a burgeoning field of rapid implementation science that I think may help us with that. But I think we have to show results. We have to do rigorous work, but we can't take forever. Because otherwise it's not going to be actionable or have the impact we're looking for.
Yeah, and I would agree. We have to get a lot better. We at CEI, we work, the majority of work we do is with governments across a number of different countries around the world, and we do need to get quicker. Policymakers need to move forward, move on. They've got jobs they need to do. They have ministers who need questions answered, even if it's best bet. So there is something about trying to accelerate the research community. And I do think that has led to the rise of groups like BIT, Centre for Evidence Implementation, Research for Impact, of which we are all leaders of these groups, because it sort of takes us a little bit out of that traditional academic world of, things needing to be delivered and published, and enables us to speed things up. Hopefully, it's not always pleasant. We don't always want to do it, but it is. So I think this kind of university partnership with intermediaries is another part of the story where intermediaries can respond quicker to policy. And very good. I'm going to go to a question here. I don't want to leave Katrina off, so I'm going to go curly question for panelists. I agree behavioural psychology is important in implementation, but what about social psychology? Katrina asks. Rinad, quick answer.
Yeah,
I'm going to leave the economist off on this one.
I think that behavioral insights include pearls of wisdom from social, cognitive psychology, decision making. I mean, I think it's such a expansive umbrella, but I would be curious to hear what our other panelists think about that. That's my perception as an implementation scientist who's been masquerading in the behavioral economics world for a bit.
Alex?
I think that a lot of the sort of key insights actually do come from social psychology as opposed to behavioral psychology, and also cognitive psychology. I mean, if you look at the social in the EAST framework, all of that stuff has deep roots in social psychology, from Ash experiments onwards. The sort of E has sort of deep roots in some of the sort of more cognitive psychology aspects and sort of Lewin area. So, I mean, the reason why we use the term BI is essentially to create a broad sort of group and a broad community where we don't actually want to kind of stop good ideas getting in the tent. So I think we could do more in that space and bring in more tools and ideas, which I think these conversations are really good at doing.
Okay.
It's more than just behavioral.
Excellent. I'm going to go to one more question, because I've now learned from the previous session that we have to stop before time, not at time. And I have some thank yous. I want to make sure I'm doing so. Shefton, it feels like education is the elephant in the room, ensuring care providers and administrators are up to date on best service delivery. How can behavioural change and education be best integrated across sectors to improve complex systems globally? It comes to you from Shefton. That's a tough question. I'm going to give you 10 seconds of thinking time and start with you, Joanne.
Sure. Actually, we've heard a lot about this in the financial education space. And I think for a long time, people talked about nudges and financial education as substitutes and not complements. And I think that was a critical error. I mean, what we want to do is, first of all, use behavioral insights to design training that works better and is more sticky for people. And then to be able to use behavioral insights, I think, to motivate behavior change that is sustained by changes in individual capability. So they need to work together in the same, moving towards the same direction. They're complements, not substitutes.
Alex, you go next. Rinad gets the final word.
I'm not sure I have a huge amount more to actually add on onto Joanne's answer. They're complements. We use them together so they reinforce each other.
And Rinad.
What Joanne said.
Hashtag. Tweet that, please.
Team science, yeah.
Yeah, tweet that. Sorry, I've got my thing. All right, well, that was, I'm going to stop there because we won't have time to answer another question properly. I want to, in particular, thank the three of you for joining this. It's particularly hard to go after you, Rinad, so I was geeing Alex and Joanne up a little bit going, got to keep that energy post-Rinad. Plus, Joanne, I want to thank you very much for joining as a last-minute ring-in. What a contribution you made. We couldn't have at all had a panel like this without you. And Rinad, you're a superstar. It's getting late there. It's your Monday night. You look fresh. You look energetic. I don't want to ask you what you're going to do to wind down now, but we appreciate that, and we appreciate Rinad is joining other sections of the conference, particularly in the UK-friendly time zone, to facilitate another conversation on common elements and service improvement, which is actually quite related to the panel that we just had here. But thanks to all of you. To avoid getting cut off again, I'm going to say to the crowd, don't forget to leave your timeline and come back into your timeline. You can't just, if you stay here, you're going to be alone for the rest of the summit. So please don't stay here. Leave and choose something else to join again. And thank you very much, and I'll see you again this afternoon for the other keynotes. Thank you.
Lately, I thought of day, right where we stay, and lately, I thought of day, right where we stay, and lately, I thought of day, right where we stay. Thank you.